May I have this privilege to request Dr. Hemani Sahib to embellish such a legend with the
to tell you that I didn't send any biodata at all. How and in what method Jatin got hold of this biodata, that I do not know. But I can say that my appreciation exceeds the excessive generosity of your introduction. I strongly believe that biodatas and introductions are literally, according to, a waste of time. But nonetheless, that is conventional. It's difficult to break out from convention, and so we do it. So thanks very much, Jatin, for the introduction. When I first received a call about this, and of course, I knew I have lost contact with Sumati Bai for many years, but it was way back in the, I can't remember, 60s or early 70s, that we are struggling to establish the Rajkot Cancer Society. And a friend of mine, Bikha Bai, very unfortunately is not there, he told me when I met him in Bombay, I said, just went to Rajkot and, there's a cancer society, few of us, Praveen Bai and all, you remember there. So I used to come to Rajkot quite often, and any invitation from Gujarat, I never say no, because that's homecoming from me. Fortunately or unfortunately, I was lodged in Maharashtra, but coming to Rajkot or Bhavnagar or Ahmedabad, I never say no, I say always yes. So then it happened that he had a piece of land, just being nostalgic about Rajkot. He had a piece of land and he says, Praful, why don't you do something, give this land to the Cancer Society, they can build this, that. And that's how the history of a cancer institute in Rajkot started, through the Rajkot Cancer Society. And I think Dr. Gupta still knows that how things are going. And so I'm very, very proud, proud in a very gentle way, that there was a little thing that pushed the land, and we got it and we built Rajkot. And of course, Sumati Bai and all that carried on. Then unfortunately I lost contact with Sumati Bai because things started moving and all that. Now how do I describe Sumati Bai? Much has been said, and how do we recognize a man? How do we adore a man? By the awards and distinctions? Maybe yes. By the silver and gold that one possesses? Maybe yes or no. I am not particularly fond of silver and gold, but there's as they indicate. But the power or position that he holds, there's so many different criteria about how you recognize or how can identify. If you ask me, how will I remember Sumati Bai, I would remember him by the height of his ideals, the breadth of his interests, and the depth of his convictions. That is the true measure of a man. What are his ideals, what are his interests, and what is his convictions? That is the true measure of a man. And if you see what he has done in the last 50 years plus, maybe more, to the people of this state, to his young professionals, he will score 11 out of 10 in my dictionary. So you can imagine as to how privileged I am to be able to come and present this. Actually, yesterday Vimal sent me a book about the poems written by him. And I was reading through the night. Actually, I fell asleep. I had to get up early at 3:30 to catch the flight. So I fell asleep. And then I again started reading in the flight through the poems which has been alluded to. And I found one which shows his humanity or the human values, apart from in any, particularly in medicine, apart from your science, apart from your technology, apart from your academic brilliance, you are known by the gentleness and the humility that you have, which are called the human values of medicine. There's one poem that I noted down. The name of the book is Manas Name Songtha, and it's a collection of his poems. And on page 29, there's a poem he has written, Sumati Radi Shake. He's able to cry. To be able to cry and emotion and sentimental is something which you have to experience, to how nice you feel when there is something which is happy or sad, and when you're able to cry, it's a great feeling. Not many people can do that, but if you cry, and he writes, Mitro સાથે મળે ને હાસ્યની જોડ ઊંચી શકે, ઉડી શકે. સાચો મિત્ર હોય તો ખભે માથું મૂકી સુમતિ રડી શકે. So see his emotion as to what he feels in times of, that this is the true meaning of life, and it shows extraordinarily his human values which he has brought into the science and art of surgery or medicine, which he has lived to the best part of his life. So, Dr. Sumati Bhai, I'm extremely again very privileged to be standing before you and say. And then the question came, what do I speak on? It's very easy for me. I have about 5,000, 8,000 slides. I can pick a few slides, pick up box and just come and just give a lecture. Very simple, very easy. But I thought that in life, it is important to know where you are, but it's more important to know where you are headed. Which roads are you going? Where are you headed in the future? And for all of us practicing medicine, surgery, or whatever, we ought to know as to where we are headed with our modern technology and all that, which is quite exciting, of course. And therefore I chose this is not the first slide. Please get back to the first slide. Okay, that's the first slide. Can I have the lights off, please? I don't need any lights. Can I have the lights off? Possible? Okay. So I chose a subject for this oration. I mean, even these lights can go off. That the ultimate goal of medicine, science, technology, as to where we are going, I think, is the conquest. Is the conquest of mortality. Science, medicine, and technology's final destination. What are we as medical men or scientists in the laboratory and the clinics trying to do? Are we going to an age where we are going to conquer mortality? And the subtitle is The Art of Medicine. This is how I began. When I started medical college in 1950, there was no technology, nothing, a stethoscope, which is never used now, very rarely used. There was the electrocardiogram. There was some plain X-ray of the chest. So that's where I began medicine learning at the KM hospital. These are the values of medicine, the art of medicine, establishing a rapport, listening to them. And one of our teachers used to say, if you listen to your patient, you can make 85% of your diagnosis just by listening, not even by palpation, just by listening. That is unfortunately disappearing. That is the art of medicine. Then, of course, the science. This is the science, the DNA, and all kinds of things by which we are progressing tremendously. And, of course, this is the technology of the current state. So all these three things, this is very much less now, but this is predominant. And the aim and objective is what? Is it the conquest of mortality? Now, how has this come about? If you see today, all of us will agree that there is a tremendous change. The whole face of medicine is changing rapidly. What is the cutting edge of modern medicine? The technology. As I believe that modern medicine, according to me, in spite of its tremendous progress, is at a crossroad in this new millennium. Public perception of the medical establishment. Public today sees medical doctors and all that, hospitals, as an establishment, or a corporate people have come in. So more of commercial thing. So the perception of the public is of an establishment. Current medicine and market forces are playing a very major role today. For good or for bad, I don't know, but nonetheless. There is no let-up at all in the clinics. As a clinician, I have to look to do more and more technology to see that my patient lives. Today, death is taken as a disease. Death is taken as a failure of modern medicine, which is unfortunate. In a critical care unit or intensive care unit, if your patient doesn't improve, you feel that something is wrong. But death is a natural process and way of all human flesh. But that doesn't matter. So there is no let-up. We're not doing more and more, we as clinicians. And also you'll be surprised what's happening in the biological sciences, the scientists in the laboratory. There is no let-up. We want to see that we win over death. If life is good, death is bad. So you cannot let it happen with our current knowledge. Contemporary medicine as we practice, it's good to evaluate what we are practicing and what is likely to be the future or the final analysis. So I chose this subject. I had to do a lot of reading, but I enjoyed it and I thought it may be of general interest to all of us rather than only surgeons and all that. So the changing phase, this is where I joined the medical college in the 50s, which was the era of clinical sciences based on anatomico-pathologic data. You operate, you see the lymph node, this, that, anatomy, pathology. That was the 50s. The 60s and 70s saw the era of technological sciences, which was based in imaging, instrumentation. You got your sonography, you got your scans, etc., slowly MRI and all that. We all know that. The 80s and 90s brought the era of biological sciences, molecular biology, molecular genetics based on laboratory medicine. Like when you operate on a breast, you know about how many lymph nodes and all that. But you want to study the breast tumor with a molecular biology. What kind of genes does it have? What kind of gene score does it have? That's more than normal histopathology. So you go a step beyond. That is called molecular genetics. This is all came about beyond standard histopathology and morphology. And of course, in this millennium, the era of genomics, biotechnology, and robotics. The genomic science is one of the most important things which is happening today, because each one of us today, if you want, you can have your genome mapped out just by a little fingertip, collect a little blood, get your cells, get a DNA, and you can get your genetic profile. I mean, the whole that's called a human genome, and it's now available to do that. And you will know what kind of diseases that you're likely to go through just based on the genome DNA and study of that. And just as the last century was a century of physics, Albert Einstein, E is equal to mc square, the hydrogen bomb, the atom bomb, so many. It was a century that was all physics. So that was the last century, was a century of physics. This century is a century of biotechnology or genomics. If the way things are happening here, this century, probably in the next one, will be known that this was a century of biotechnology, biogenetics. I do not know it will happen, but it could happen. I will go quickly over this. All of you know about this, how technology has come into surgery, and the laparoscopic or robotics and all that has brought a tremendous amount of comfort to the patient, less pain, quick recovery, etc., etc. And then, of course, this is a robotic surgery. But one thing what has happened here is that here is a surgeon managing his control, and that is a patient there, far away. We are going farther and farther away from the patient with technology. A patient comes to the abdominal pain, there is no time to listen. Get your sonography, get a blood count, urine count, and then come. So we are getting farther and farther away because of this technology. Technology has done tremendously good things, no question. But there could be proper use, abuse, or misuse of any technology or anything. And that's probably creating more and more distance between the patient, and that's my belief. And I wonder why is he sitting here? He could have as well be sitting in his office. And same thing you can do and it is happening, that you can do robotic medicine at a telemedicine at a distance. A tremendous powerful educational tool. But nonetheless, so this is technology, how is it coming on? So the present scenario, if you can sum up, that the art of surgery and medicine is rapidly changing into a technical craft due to market-driven forces of science and technology. Please remember, we have to accept, though we are a product of the environment with which we are born, we are the result of the environment which we live. And we are living in an environment, not our fault. The environment surrounding us is changing, so we have to be in the process. We are also subject to the environment in which we live, and therefore, each one of us are affected by the market-driven forces of science and technology. Medicine is driven by market forces. Fundamental science, research, everything moves by market forces. If I am a geneticist working in a big laboratory like Bristol Myers or something, I am always under pressure by my CEOs to publish something, whatever, whether it is premature, whatever, publish something because they want their stocks to go up. That's how an honest scientific geneticist who is working, he knows that it is not right for publication yet. But I am under the pressure, market forces, because Bristol Myers or Smith Klein or whatever ABC company want their stock to go up. That's how that science, the scientists working in the laboratory, just as we are working in the clinics, are impacted by the environment. And that's why it is a market-driven, whether like it or not, this is true, and we must accept it. One of my friends in the United States, he's a great endoscopist, and once when the endoscope, I started when Dr. Antia used to do that rigid endoscope. And I'll never forget, you have to hold the head like that and Dr. Antia will push. So those were the days of the 60s. But now with the fiber optic and all those modern instrumentation. So he says this, he once remarked that this kind of endoscopy is like a remunerative, somebody gave the word, that endoscopy is a remunerative, treat remunerative gastritis. So anything, any pain, just drive, or any little distal bowel dysfunction, put in a scope and see. If there's a little polyp, you just remove the polyp. So those are the remunerative, not scientific, but remunerative endoscopies. So this happens to all of us. There is nothing, but this is the lighter side of the story. But, sorry. Let us talk about contemporary medicine. Is it all-knowing? Do you think we know everything about it? We think we have made tremendous progress. Is it all-powerful? Is it all-successful? Or is it a media hype? Every now and then, every week, you'll find something in the paper about some drug or something, which is nothing but given by the public relations or media of a particular, that trial was done on 200 cases, and this is found to be better, or chocolates are good, or wine is bad, whatever it is. So that is all media hype. So don't pay much attention to what you just suddenly see. That despite technological advances, limits to medicine must be recognized. We know technological advances has done lot of people live longer. There is no question. It's not it's because he came with a longer life. We were instrumental in coming there, so he lives longer. But that is something. So, but a point comes where medicine ceases to exist in the human system. Those limits must be recognized. There are few cures, of course, alleviation of many diseases and prolongation of lives because of contemporary medicine. You cannot deny that. Unfilled expectation with escalating costs leads to distrust, anger, and litigation. If you do an audit of our investigations or audit of all what is happening, there is no audit in this country. There is no medical audit. I tried to introduce audit at the Tata Memorial to a certain extent about mortality meetings, morbidity meetings, and why did you do this investigation? It worked a little, but it's difficult to do audit because you get a lot of friends and admirers and enemies if you really want to do a good medical. But if you do audit, it will be shocking anyway. And therefore, because of this, you need more and more, and also medicine is becoming defensive. If somebody comes with a headache, and if I don't do a scan, which is ordinary, probably because his eyeglasses numbers have gone up or little something else, but I will do a MRI. Why should I? Because something happens 2 years later, he says, you did not do the MRI. Why did you not do it? So that's why we become more defensive and over-investigate, which is a price for the patients to pay. And over-investigative approach. Reluctant to take risk in a dire critical situation. We don't want to face a court of law. Unfortunately, I have that experience. Erosion of patient-doctor relationship robs medicine of its human values. And the practice of medicine is not equivalent to a consumer product. And of course, there are consumer courts everywhere. Consumer, you go and buy a piece of your television or something, and if something goes wrong, you can go to consumer. So we are being equated as consumers, treating consumers, which is so wrong that you cannot treat medicine as a consumer product, but there it is. It is there. Contemporary medicine, therefore, must remain a harmonious mix of science, technological advances, and bedside clinical art. We must critically evaluate our successes versus our failures, benefits versus risks, and the value of old treatments versus new practices. Please understand that all the new advances are based on the past experiences or past practice. And the practice of science and medicine without conscience is nothing but a death of the soul. I know this is not the right thing I'm doing, but doing it, whatever. That doesn't really mean that you... But there are positives and there are negatives in contemporary, our present medicine, that prolonged control of incurable disease, cancer, coronary, joints. These are all chronic diseases, but you can control them for longer and longer period. More space for many of us. Progress of science and technology, these are all the positives of contemporary medicine, and we are privileged enough to be present to witness that contemporary medicine. But there are negatives. Much mechanization, super specialization, commercialization.